Hey there, David Chesworth coming to you from Hilton Head Health on the beautiful Hilton Head Island, and we're bringing you another episode of Health Talk. Today we have an exciting guest, a family doctor turned health coach and motivational speaker. Her name is Dr. Kathryn Tapper, but she goes by Dr. K Tap. So Dr. K Tap, she is the founder and chief vision officer of Glow Coaching. She's a holistic health and wellness expert. She is Mayo Clinic trained, board certified family medicine physician. And she is an author of the upcoming book, You Are Greater Than Your Diagnosis, 10 Steps to Glow Up in Life from the Transformational Story of a Doctor's Journey as a Patient, to be launched this summer. So a lot of super exciting stuff. Dr. K-Tap, thank you so much for joining us today. Did I miss anything?
No, you got it all well.
Got it all.
So,
Excellent.
so good to be here, David. Thank you for having me on this podcast. I'm so excited for our conversation today.
Oh, likewise. Super pumped. So actually, I thought we could just dive right in. You have a really interesting professional journey, starting as a family physician turned health coach and motivational speaker. Can you kind of walk us through how that all happened?
Sure. So, briefly, I always knew that I wanted to be a physician. I grew up in Jamaica and I came to the States after high school to start college. And it was in my second year of college that I became ill. And so I had a diagnosis of chronic end-stage renal disease, kidney disease. And so, as you can imagine, as a 19-year-old, my life just got tossed and turned in a different direction. But I still wanted to become a physician. So I got through college, went to medical school, trained in family medicine, and now I'm here in Florida. And I started my journey as a family medicine physician outside of training and everything. And it was a couple years ago after I did get a transplant back in 2014. But a couple years ago, I had to go back on dialysis. And I was already burnt out in the clinic, as you can imagine. And I knew as a shift was taking place within my health, a shift had to take place within my career. And I had this light bulb moment while I was working in the clinic that I am actually coaching my patients anyway, right? I am someone who usually takes a holistic approach when I am treating my patients, promoting health, whatever that is, instead of going straight to medication. And I realized I can do this outside of the clinic on my own time, taking care of my own health with that freedom and that flexibility. And so that's really that point in which I transitioned into going into health and wellness coaching. So that is how that all started. And I also always knew that in the back of my mind, I wanted to write a book about my journey and the steps and the tools that I have learned to really live a fulfilling life, especially if they have a chronic illness, to know that they can live a fulfilling life as well. So that's what I'm very passionate about.
That's the vision and mission. So you said something that I thought was very interesting, that when you were a practicing family physician, you naturally had this holistic approach, and you already were naturally doing this coaching process. Was Because that's not always the case with doctors and physicians. Was there anything different about your training or your background that led you to have that approach versus the more, jump to medication first approach?
Honestly, I always had that in the back of my mind. And even
Mhm.
before applying to medical school, I wasn't sure, should I go the naturopathic route? Should I get a DO? And so that was always implanted in the back of my brain. And I think a lot of that has to do with my culture. We usually have, different herbs and things like that. And so I think that had a lot to play with, that being at the core of what I do. And so when I went to medical school at George Washington, they had an integrative medicine track. So I immediately joined that track to get more background information about holistic health and wellness. And so I've always done that research on my own.
Very cool. So it was part of your upbringing almost to kind of be thinking that way, and then you sought that type of professional path out as a result.
Exactly. Exactly.
Very
Yeah.
cool. So I was looking at your website a little bit before we were talking, and you have a slogan on there that says empowering women to dominate their diagnosis and live their destiny. So can you paint me a picture about how you do that? If I'm coming to Dr. K Tap, how do you get started? What does that process look like?
So when my clients, I almost said patients, when my clients come to me, they're usually struggling. They feel lost. They feel lost. They feel like they need some guidance. They need accountability, right? And they often feel like they're limited by their diagnosis. And so as they come into the program, there are different pillars that I have in the program. And the first pillar is awareness, understanding, and most importantly, acceptance. I find that that's where a lot of my clients are stuck, is accepting where they are with their health in order for them to move forward. Because if you don't know where you're truly starting from, how are you going to really know where you want to be and how to get there? So really starting from where they are now, and then once they understand where they are, who they are, that they have the power within them to truly be and do what they want to be and do, then they can go and become their vision. So it really starts from up here with that mindset shift, that instead of going from I can't, I can. Instead of going from I don't have, look at what you actually have, right? And it's such a game changer. It opens up their mind. And once their mind is open, then I give them the strategies and tools in terms of, how to eat, moving in a way that feels good to them, right? Letting them know that sleep is important in their health, letting them know that they can manage their stress in a healthy way. And one of the other things that is really important for me is showing them that what holistic health looks like, right? Because we may all have heard the saying health equals wealth. But what does that truly mean? We all heard of it, but have we really stopped to pause and think about what that means for your life, right? If you don't have your health, you're not able to work optimally, provide for your family, and do the things that you truly want to do. So I came up with something I'm going to share with you. It actually happens to be
Okay.
right beside me. And so I created this thing. And so it's a flower. Sorry for the reflection. It's a
I
flower.
see. Yep. It says
And
you in the middle.
you in the center of your life. And each of these petals are different categories of health that we really need to think about, right? Because we usually just think about physical health. And sometimes, secondly, we think about mental health, right? Those are the conversations that we're having. But what about spiritual health? Are we really thinking about our health in terms of our relationships? What about environmental health? We're not talking about that enough. Financial health, sorry. Environmental health, our work and our purpose. I don't think environment is on here.
Yeah.
No, I need to add that on here.
But also a good pedal to add. Yeah.
But it's so important to really think about our health holistically so that we can make the connections that are happening within our lives. So, for example, suppose someone is having headaches, right? And they're maybe stressed as well. Maybe they're not putting the pieces together that they're stressed. And as a result of that, they're not sleeping well, right? And as a result of that, they're having headaches, which is causing them not to be productive at work. And you can see that rippling effect just from that one thing that is happening within their lives. So I truly think it's important for us to be aware of how we are living our lives, what we're paying attention to, so that we can see if it's working for us or not. That's the key, right? Is it serving us well? And if not, then we can change it and do something about it.
You got a lot of good information there. And I actually want to go back to something you said a little bit earlier about acceptance. So I'm curious if you've noticed in your patient, in your physician work life and your now health coaching life, when it comes to acceptance, is there a common theme you noticed of why that's a challenge? Do you notice that it's like they're former athletes, or they used to be, or they're comparing themselves to others, or is there any kind of theme that you noticed as to why that's such a challenge?
I think it is, no, I know that it is a challenge because it's a big shift that's taking place and it can impact their entire lives. It just depends on what the diagnosis is, right? And it's the perception that if you have this illness or if you have this diagnosis, that that is what defines you.
Mm.
And what I do is I help them to separate who they truly are from the diagnosis.
That's a really good perception. You know, now that you're saying that, I've actually noticed that here at Hilton Head Health with some of the guests who come through the door, where they do, like, a big part of their identity is an injury they had a decade ago, or an illness they had that they don't have anymore, or it's not technically playing a big role, but they still feel like it's a part of who they are, and a self-limiting thought almost.
Exactly. Yes, yes. And when they're able to come face to face with acknowledging that that's first of all what's going on, like they're really identifying themselves with this illness, being aware of that, and then saying, "Oh, I am not my illness, or I'm not my injury." And maybe there are things that are changing within my life, but I have, this is key, I have control of what I think, how I feel, and how I respond. I may not have control of what is going on around me, or what the diagnosis is, or what the injury is, but I still have control.
Mm-hmm.
And it's grasping that power. That is the key.
Do you think that sometimes, well, so it seems like sometimes it could be that holding on to that is maybe a fear of change, and an easy out to not change is holding on to that. How much of it do you think is that versus like truly believing it is who they are?
That is such a great point, David. Absolutely. A lot of that has to do with the fear, that seed of fear that's implanted in the back of their heads that says, "Ooh, I can't do that." Or, I don't know, and I don't want to try. I just want to stay safe over here,
Yeah.
right?
Right.
Well, that's what our brain does.
Right.
Our brain is there to protect us. And that is something that's so important, is that the way how we think about our health, and whether it's an injury or an illness, it's not personal. It's identifying that our brain is there to protect us. But again, once we realize that, then we have a choice to make going forward.
Mm-hmm. It is interesting. I mean, it's so real, and it's ingrained in our brains that change can be uncomfortable. Change is uncomfortable. Change is hard, and sometimes change can feel so overwhelming that it's not logical. But somehow we convince ourselves it makes more sense to remain in this discomfort of
Yes.
staying the same versus going through the discomfort of changing.
Yes, exactly. And it's so important for us to really take responsibility for our health.
Mm-hmm.
As you said before, it's so much easier not to. It really
Right.
is. It's so much easier just not to, and to just complain and to just stay where you are. But the way how I like to look at challenges and change is that it's there for us to grow. We
Yeah.
are evolutionary beings. We are here on this earth to grow. Nature is a beautiful example of that, right?
Absolutely.
But if just think about it, if everything remained the comfortable, if we had all the money that we wanted and all the health that we wanted, we wouldn't move. We wouldn't
That's
change.
true.
That's why we have these challenges, but it all depends on our perspective of these things that come up in our lives. We have the choice to make as to how we are going to look at the health challenges, since we're talking about health here,
Yeah.
and how we want to move forward and how we want to live our lives.
So you mentioned perspective, and then earlier you mentioned shifting from can't to can. I'm curious, how do you, it sounds easy, how do you get into a can do mindset versus a can't do mindset?
I love that question, because you're right. It's easier said than done, right? She's like, yeah, she says that, but I'm just in this bind and I feel like I am on a hamster wheel, or I feel like I'm in a sinkhole and I just cannot get out, right?
Right.
So because we have been thinking in a certain way for a very long time, the first thing to know is going to take some time to really actually feel that empowerment, right? And so the first thing is to know that we have to retrain our brain. And one of the things that I think is very important, I know it's very important, is affirmations, right? Saying those things out loud, writing them, using all of your senses to really feel what you are saying. And what I like to do with my clients is, actually, that's in the first week of the 12-week program that I have, is for them to write down their limiting beliefs. And then they are the ones that are going to make or create their affirmations, because it has to be believable for them, right?
I was going to ask you about that. So that's a key factor, is it's got to be positive yet believable.
Exactly. So for example, if you are, let's say that you are feeling anxious, right? And you want to get out of your anxiety, you're not going to say, I am the most calm person in the world and I absolutely feel peace and harmony. If you're going from a state of increased anxiety, that's just not going to work for you.
Right.
However, if you were to say, today I choose to feel less anxious than before. That's a baby step in comparison
I love
to what
that.
you said before.
So instead of saying I feel calm and peaceful, you would say I choose to feel less anxious or choose to feel more calm.
Exactly. So
Love that.
creating that inner dialogue that really resonates with you, so that you can feel, it's not just about saying it, it's about feeling it, right? Because everything is energy. Right? So the thoughts that we think, the things that we feel, the actions that everything is energy. We know that from grade school.
Right. Well, I mean, my background's in fitness, so that really resonated with me, because you wouldn't go from, being sedentary on the couch to running a marathon the next day.
Exactly.
Right.
Same concept. I love that.
Yeah.
Yep,
You got to figure out, first you got to go for a walk, and with affirmations, first you got to say, okay, take how you feel now, and how can you be like just an itty bit more positive in the way you think that.
Yes,
I love that.
exactly. Yeah.
And I love how you phrased it around an action of I choose. That's powerful.
Because you're putting that ownership and responsibility on you, which is key.
I love that. So I had a guest about a month ago who was talking about that fake it till you make it concept, and she's like, I'm not a huge fan of that because it's got to be believable. She was kind of in the same ballpark as what you were saying, but she didn't take credit for it. She overheard it somewhere on YouTube or Instagram, and she heard someone say, "Face it till you make it." Yeah. I thought that was really great.
Yes.
Repurpose of that phrase.
Yes, I love that. I'm going to use it.
Yes.
I won't take credit, but I will use it.
Take it. Yeah, we can't take credit either. It's worth spreading.
Yes. It goes back to something that I usually say when you're looking at fear. Face the fear, but don't focus on it.
When you say fair, do you mean like if something is unfair or fair? Is that what you mean by fair?
FEAR.
So fear. Gotcha. Sorry.
False evidence appearing real. So face the fear, but don't focus on it. That just came back to me as you were talking about.
Face the fear, don't focus on it. So what's a practical example of facing the fear without focusing on it?
So it kind of goes back to maybe the I can't statement, right?
Mm-hmm.
Because there's usually some sort of fear why you think you cannot move forward,
Mm-hmm.
right? So even doing the affirmations is a great way to reframe again, to say, okay, this is something that I can do. You're facing it, but you're doing it in a baby step way.
I gotcha. So you're not having analysis by paralysis. You're not just thinking about the fear. You're acknowledging it, but taking an action to overcome it.
Absolutely. Well
Gotcha.
summed up. Exactly. Yeah.
Okay,
Mhm.
that makes sense.
Mhm.
So, and I love that. So, with the amount of people you've seen in coaching and as a physician, what's the most common challenge that you've seen, or is there a most common challenge that you've seen?
I would say that the most common thing, it really goes back to, well, first of all, they may be confused about kind of what to do next,
Hmm.
because there's just so much information out there,
Totally.
and you can get misguided so very easily, right?
Right.
So I see that that is one of the problems. And then the other thing is accountability.
Mm,
Those are the two things that I see a lot. And I'm going to just put into the mix the acceptance that we've spoken about before,
sure.
about where they start really, when people get over that hurdle, it's such a game changer, because now their minds are so much more open. There's a new realization, right, about the power being within them, that they can take control if they're ready to. Again,
Hmm.
back to the choice that they have, right? So those would be the things. The confusion piece is so big. They come feeling misguided, and they want to feel whole. Some, right? They want to feel healthy, but I really just don't know where to start. And
Right.
a lot of that has to do with trust, right?
Right.
Trusting the person, or trusting the team, trusting the coach, trusting the physician. That's a big part of it as well.
Absolutely.
There's just so many
That's
different.
something our director of education here talks about that too. How there's just the world we live in now. There's no lack of information sources. There's an overabundance of it, and it can be hard to navigate what's the right approach, what's right to do, what's good, what's not good, um, and so there can be this, again, analysis by paralysis because of information overload. But
Yes.
um, so, I mean, one thing that his name is Bob, our director of education. He has this. He's full of mantras, and it sounds like you might be too. And the coach, like the simple phrases and slogans, but he has one that he uses, like he calls it the I-95 of nutrition, because nutrition is his
Mhm.
area. And he said, if we take an example of going from a road trip from Florida to New England, for example, at some point, no matter where you're going to in New England from Florida, you're going to have to get on I-95. So he calls this the I-95 of health. So
Got it.
there are common themes that will work for most people, but at a certain point, in order to get to your destination, you need to take a personalized exit, certain streets, certain turns, certain routes. And that's where it might be worth working with a professional in the context of nutrition, maybe a dietitian, or a nutrition coach. But in general, what we try to do here, and it sounds like what you're trying to do too, is to simplify and talk about, what are these common themes, these common threads where we can trust this
Mhm.
is going to work for most people. And of course, everyone's unique, everyone's different. And that's where working with an expert can really help navigate that. But you just reminded me of that, the I-95 of health. Yeah.
I love that
Yeah.
I-95 of health. Yeah,
Yeah.
yes, yes. It's true. Yes, we are all individuals, and we need to remember that. So if someone, or if you hear of someone saying, you need to do this for your health because this is going to work. Yes, it might work, but maybe not for me.
Right.
Right.
Exactly.
Right. And so it's so important for people to remember that they are on their own journey. And this is so important, and this is something that we don't do enough, is listen to our intuition.
Mhm.
That is a big part of our health that we are missing. we are listening to everybody and all of that, which is fine, but we really also need to listen within ourselves for guidance.
Well, I completely agree. And I think that there's this really important element in pursuing your own health, that there's this pillar of feeling like you're the one determining and creating for yourself. It's kind of like the rebellious teenager thing where you were gonna make your bed. It was on your to-do list that day, but your parent noticed you hadn't made it yet, and they said, "You got to make your bed." And you're like, "Well, I was gonna make it, but now I don't want to because you
Right.
told me to." I don't want you thinking this was your idea.
Right. And that's
Yeah.
such a great thing that you mentioned, David, because again, it goes back to how you are approaching things to people, right?
Right.
So important, the delivery of the message, the delivery of the educational material. You have to know who you are talking to so that they can receive the information in a way that they're going to actually use that information within their life to uplift their lives. So important.
Absolutely. And it seems like I can already tell just by talking to you that you have a very non-judgmental energy, very low pressure interaction approach. I would imagine it's very easy to open up and have a curious mindset with you, which is so important when trying to make change. Something we have to, in some of our group sessions here, we often have to start with the disclaimer of, all right, we're going to enter into a brainstorming session, and let's cultivate exactly that, the spirit of brainstorming. For right now, no idea is a bad idea. It might not be the right idea for you, but let's just throw ideas out there without judgment and see if something resonates. And I can already tell just by talking to you that that happens naturally,
Mm.
interacting with you.
Yes, it's such a big part of I guess what I do. And I think a lot has to do with one, how I grew up, but also becoming a patient before becoming a doctor and a coach.
Mm-hmm.
So that has been such an amazing journey to have that perspective, because now I'm able to understand more of what that person is going through. Not
Mm-hmm.
exactly, but on some level.
You've
And
had you've had empathy training, but not on purpose.
exactly, exactly, just on a different level, on a
Yeah.
different level. And that has definitely helped. And a lot of people don't trust because they're even been misguided or
Mm-hmm.
they've been judged. And it's
Mm-hmm.
so important to create a safe space for people to really be honest with themselves and be honest with the person, such as myself, to coach them. Because if we don't have that honesty, what are we doing?
Mm-hmm. So I'm curious. I'm curious if there was ever a point for you, because you've had your health challenges over the years with your kidneys. If you ever felt like that was part of your identity and you had to wrestle with that and detach from that, I'm curious if that was your journey.
This goes back to college, right? So that's when I was diagnosed. And there was just this innate, I can't explain, inexplicable, where I was determined to just do what I had to do
Mm-hmm.
to become a physician. I didn't even take time off from school. I don't know how I did that, but I just went straight through. I took time off after I graduated from college though, but there was just innate sense of service.
Hmm.
There's this innate sense of service even before diagnosed, but even more that was confirmation for me. And so there was initially where I felt I didn't feel confident with talking about my diagnosis.
Hmm.
I it's almost like I pushed it to the side a little bit to do what I needed to do.
Mm-hmm. It
So
was
there was
this little inconvenience.
yeah. And so I did not accept it fully initially.
Mm.
And so when I learned how to trust myself, trust in something higher than myself, I was able to really feel that inner confidence within myself to move forward. And so that's why I'm able to teach other people what I've learned, right? Is because I've learned all of these different things that has really allowed me to accept where I am, live a fulfilling life, and just be of service to other people.
That really stood out to me when you said that it almost seems like there is this part of your identity of providing service and giving back to others that is just so overwhelmingly powerful within you, that it sounds like that was a strength of yours that helped you to navigate and figure out how to accept where you were and overcome that and take this thing that many people would consider a huge or unfortunate circumstance that they might identify themselves as, but you took that unfortunate circumstance and flipped it upside down into a positive and said, this is actually a circumstance that gives me more power to serve others.
100%, David. And a part of that, I think for other people, that's going to be helpful for them is to find out what their purpose is in life.
Mm-hmm. That was one of your petals on your flower.
Correct.
It's all coming together.
It's all coming together.
Yes.
It's all blossoming.
Yes. So how long have you been a health coach now? When did the transition happen?
Literally a year ago.
A year ago. Okay.
Last April, officially. That's when I stopped working in the clinic and decided it's time to take care of my health in a different way. It's now time to serve in a different way as well. So yeah, just a year ago.
Wow.
But I think it has always been a part of me, let's say.
You've always been using the coaching skills, but now you're formally
exactly.
Being mindful in the moment and really creating purpose, seeking purpose.
Mm-hmm.
I love that.
Mm-hmm. Mm-hmm.
Well, are there any final thoughts in addition to that you'd like to leave our listeners with?
I think that would be it. And just to think about what I just said in terms of your overall health. Just going back to that. Mm-hmm. Health equals true wellness. Mm-hmm. And it's so important for us, for you to prioritize your health. One step at a time in order to find that true meaning and purpose in your life. We're all here for a reason.
I love that. Well, Dr. K-Tap, it's possible this episode could either come out soon before or soon after your book comes out. Is there a specific release date for your book or a month that your book might be coming out?
Yes, my book will be released in August of this year.
Okay, August of 2023.
Yes.
Keep your eyes open for You Are Greater Than Your Diagnosis, 10 Steps to Glow Up in Life from the Transformational... Oh, yes. Let me say that again. That's okay. Yeah. So keep your eyes open for the book, You Are Greater Than Your Diagnosis, 10 Steps to Glow Up in Life from the Transformational Story of a Doctor's Journey as a Patient. Dr. K-Tap, it has been a pleasure. Love getting to know you a little bit more. Love hearing your stories, your tips, your information. You have brought a lot of value to our listeners, to our guests. I just know it. So thank you so much for your time today.
Thank you so much, David. It was such a great conversation today.
Absolutely. Well, until we meet again, we'll see you next time. Thank you so much for joining us today. We hope you enjoyed listening to the conversation with Dr. K-Tap. And as always, we hope you got a lot of value from listening to this. Be sure to let us know who else you'd like to see on the podcast. What topics would you like to hear us talk about? Remember, ultimately, this podcast is for you. We want you to get the most out of it that you can. So thank you so much for joining. See you at the next episode.